Hey guys, welcome to the 1HP YouTube channel. You might notice an unfamiliar face sitting to my left, right. Orientations are weird when your camera is mirrored. This is Jess. She happens to be my sister. She is an occupational therapist. She's done a whole bunch of work, especially with patients who have hand injuries. And at one point you were kind of on track to do like the whole certified hand therapy route, decided that maybe it wasn't for you, but still have a whole wealth of knowledge to use from it.
Yeah. So it might be something that ends up happening down the road, but I'm not currently working in that practice area. And it's been neat to continue to still use that type of knowledge wherever I'm doing whatever I end up doing, whether that's my own occupations or helping other people who are just trying to do their normal everyday stuff.
Right. So, like, for people who aren't familiar, occupational therapy doesn't just refer to, like, how you do work or a job.
Yeah.
Also, common
Yeah.
misconception, occupational therapists don't just do hand therapy.
Right.
We get that a lot when I worked at the hospital. So like, before we delve into today's episode, tell us a little bit more about what occupational therapy is broadly.
Yeah, absolutely. So my elevator speech, which is like if you ask me this question in an elevator, I could answer it in 30 seconds before we get to the floor. Occupational therapy is what you occupy your time with. So if that happens to be your job, awesome. That's what you're coming to me to work on. Um, but it can be anything. Mostly our big ones are working on activities of daily living with people. So getting dressed, getting yourself fed, cleaned, clothes on, all that stuff. Um, and then things you do for fun, and then things you do for your job. Those are like kind of the big three. But again, it's anything you occupy your time with. That's really where we get that occupational therapy piece, because anything that you do is an occupation. So going into occupational therapy means that we look at everything with a super functional lens. So a lot of our goals, like we might be working with someone who's also going to physical therapy, but our goals might kind of be phrased differently. So if we're working with somebody who had a injury from sports, say, and that's their goal is to get back to playing that sport, a PT who's working with them, if they had like a broken arm, might be more keyed into those range of motion variables. And that would be a part of our goal, but we would always kind of frame that in that functional way, like hopefully achieving 45 degrees of flexion or 90 degrees of flexion in order to do whatever. So just kind of always having that functional lens.
Right. And that's definitely like the aim with PT as well. It's why they're really complementary professions.
Sure.
I know it's really cool that we both went into like these particular fields.
Yeah. I mean, I'd be lying a little bit if I said I went into OT because you went into PT. That there's a little bit like, I'm going to do my own
I'm gonna do a
thing.
different
But
thing.
yeah. But definitely so complimentary and hilarious that here we are both down the line specializing in hands.
Hands and
And
games. There we go. All right. So, hands and games is where it's at today. We are doing Hand Science 101. So, basically, understanding the architecture, so the structure of your hands, and then the function of various parts and pieces of your hands. This is kind of going to be part one of a 2-episode thing. First part is going to be just the basics of what it is and how it works. The second part of it is going to be what to do about it when it's not working. So let's start a little bit with structure. So in this case, it would be the anatomy of the hand and wrist. Take us through it.
there's a couple different ways that we can talk about hand structure, and I think it makes sense to kind of build from the most basic level of stability up. So starting with bones, our bony anatomy, you've got two bones in your forearm here. That's your radius and your ulna. And your radius is on your thumb side, ulna is on your pinky side. And then moving down into your wrist, you have a mess of teeny little bones called carpal bones that are all located in your wrist. And there's a lot of really intricate joints in between them. So they all kind of shift subtly when you do movements with your hand. So those bones make up your wrist here. And then moving into your hand, you have the rest of the bones, metacarpals, which connect your carpal bones into your fingers. Then you have your actual phalanges, and those have three bones, which are where you get your three knuckles from. So all the way up, 1, 2, 3, and except for your thumb, which just has 2. So that's your basic bony anatomy. There's a crap ton of joints in your hand. I think if depending on how you count, it's anywhere like between around 27 is with a general accepted amount because there's all those teeny joints in between your carpals.
Yes, there are serious arguments in the medical community about what constitutes a joint and in what fashion. If you ever want to hear some of the most boring arguments ever, go look those up online. So then, on top of the bony anatomy of the hand, what overlays that next? Kind of like how are those things organized, kind of more broadly?
Right. So going from same deal, going kind of from your elbow all the way down, then you've got your next basic unit of structure is your muscles, which are connected by to your bones by tendons, and then your bones themselves are also connected with ligaments. So those are the kind of at the same similar level. We've got bones, connective tissue, and then muscles. So that's really the three. That's the breakdown of the three kinds of structures that you have in your arm, and then you have skin on top, really. Um, Muscles themselves are held in place by these big, thick sheaths of connective tissue called fascia, and those just kind of keep your muscles in one spot. When you peel off that weird white layer on top of chicken, that's what fascia is. It's this white connective tissue that holds that muscle in place. So then those muscles are connected to your bones, similarly with tendons again, and those tendons go all the way down your whole forearm. So starting up in your elbow, the muscles that actually move your fingers live up there in your arm because your hand is not super big, so there's not a lot of room for a lot of muscles in there that have a lot of power. So the majority of your control muscles for your fingers live in your forearm, and they're connected down with like a lever and pulley system into your hand. So this cool picture is all of those tendons going into your hand. They're the extensor tendons that are responsible for doing your finger like this or your thumb out to the side like that. They move in through the back of your arm because up here by your elbow is actually where all those muscles live. That's where you get your power from.
All right. And so
Yeah.
then let's also talk a little bit about kind of the way that the hand is shaped, I guess. And this is pretty relevant to literally anybody who uses a mouse, or really anybody who uses a controller. You've probably tried to find a controller or a mouse that fits the curves of your hand really well, but you probably didn't know that the curves of your hand are actually broken down into very specific kind of anatomical shapes.
Right. So there are two directions and then three actual curves themselves. So if you just kind of hold your hand up in front of you, it rests kind of in this natural C shape. And this curve that travels along up your, in the middle of your finger from your wrist through your middle finger up here, that's called the longitudinal arch of your hand. And then there are two transverse arches. So if you look at my knuckles, you can see there's another curve there. So knuckles across is the distal transverse arch, and then there's another small arch in your wrist here that's kind of hard to see unless you're like just looking at your skeleton. That's the proximal carpal transverse arch. So there are those three, and those develop on purpose because they actually put your hand in a really comfortable resting state for all your ligaments. And mouses are designed to conform to those, and so are controllers. So that's part of the point of why they're supposed to fit you comfortably. And if you're playing with a mouse that is too small or too big, you're going to notice because your hand's not actually resting in a position that's comfortable for you. So shopping around for something that feels comfortable when you're just kind of resting on it, that's actually what your hand is made to do. So you want to find something that really works.
Yeah, and small plug, check out the link below for our guide to picking out a mouse that fits your hand properly, because we talk about how to use your measurements of those positions of your hand to figure out what mouse size fits you best. All right, so now we've gone over the structure. Let's talk a little bit about the function of the hand. What movements do the hand, wrist, and forearm do, and are any of them like really super duper isolated, or most of them just go together?
When you talk about them, you can talk about them like they're isolated, but you don't like just to do this in your like normal everyday life pretty much ever. So most movements that you make are going to be a complex movement. Like just that in and of itself is combining a bunch of different things that are happening. So your forearm really has two main ones, and I'll just go like this for you. So it's palm all the way up and then palm all the way down, which is supination and pronation. And then at your wrist, you have side to side, which is known as radial and ulnar deviation, and then flexion and extension. So again, side to side flexion and extension. And then moving down in your wrist or into your fingers, similar deal, flexion for all of them, extension for all of them, and then my favorite ones, because I'm a nerd, are all the cool little individual functions that your thumb can do. So those opposing to all of your different digits, which allow you to grasp circular things, use your mouse.
Like Cheerios when you're a kid. Like very important.
Yeah. Or a controller, reaching across all of those things. So your thumb is super fascinating. So if it wasn't able to do all the things it did, you wouldn't be able to do what you love. So side to side out like that, that's depending on who you ask. Different people call that different things. Some people call that extension and flexion. So that's what we will. And then away from the palm, AB and AD adduction. So that's like quacking like a duck, like that.
I always did it as an alligator mouth.
Yeah, also that.
All right.
So again, really like you're
right? They all go together.
What was that?
All of these movements are like multiplanar, right? They go together. They
right, exactly. So you don't move in these like single planes of motion pretty much ever. Most of the time, everything kind of gets combined. There's a really cool like phenomenon-ish that they call dart throwers motion, which is like when you bring your fingers back, you're usually bringing your wrist to the side, and then you're throwing that dart forward. You're also bending your wrist to the side as you extend those fingers forward. So things just kind of go together because your muscles and tendons are like a pulley system, like we said earlier. So there's actual like mechanical advantages that are built into your body to put your muscles in the most powerful position to do things with the least amount of work, because that's always what your body wants, is to do efficient things with the least amount of energy and to do it safely and pain-free, which is pretty smart, I think, for your body.
All right, so if you're having problems with these movements, what are kind of the main causes for those problems? Like, we broke it down really globally, like really broadly.
So really problems come from 3 singular areas, like we said, and we broke it down pretty simply. When we talked about those major structural bone, connective tissue, and muscles, those are kind of like where we look to, is there anything wrong? Obviously, if you have a finger break or a joint dislocation, that's like kind of its own category, because that's not our specialty. You can go see someone else for that and then come see us when you do.
All right, fine. Most of like the gaming injuries we see, let's go with that.
But the gaming injuries that we see, most of them are going to fall into 3 categories. That muscular one, so either your muscles, you might be feeling tightness, weakness, or you have some kind of combination of that where you have some muscles that are either tight or too strong, and then other muscles that are weak, and so those strong muscles are kind of overpowering the other ones, and creating kind of a feeling of kind of instability or weakness. Then the second one is joint laxity, and that isn't something that's really just you personally. So that's affected by your genetics, affected by your hormones, it's affected by things that you've done in the past. Like if you've played piano, I have like crazy stretchy hands because I played piano for a while growing up. So my hand span on my left hand is way more stretchy than my hand span on my right. So that's just because of an activity that I was doing. So that joint laxity, that doesn't really change too much throughout your life unless it happened to you when you were younger. So muscle tightness or weakness, joint laxity, and the third one's inflammation. And usually there's going to be pain kind of mixed in with any of those, but most of all with inflammation.
Right. And so like one of the really key things for both of our professions is breaking down that pain is a thing that happens. Yes. Pain really becomes relevant and important when it impacts function. That's not to say that we don't want our patients to have pain-free lives, because we do want our patients to have pain-free lives. But even more than pain-free lives, we want our patients to have functional lives where they're able to do all of the activities they want to fill their time with, anything that they want to occupy their time with. And so it's been really, really important. There's been a kind of actually a shift in medicine. There was a shift towards using pain as what was called the 6th vital sign, up there with like heart rate and blood pressure and temperature, to recognizing that if we only focus on pain in that kind of isolated capacity, we're really neglecting the degree to which pain and function interact. And right. We really need to look at them together. Just like we don't look at any of these, just like we functionally don't look at any of these motions in isolation, even though we might measure each of them individually to get a better sense of which part is breaking down, we don't look at pain and function entirely separately from each other. We look at how they correlate.
And I think that's a huge key and kind of lead into our like part 2 of this is like how to tell when something's wrong and how to tell when you are having difficulties with movement. Usually pain is a key sign of that. Like most of the time, either pain is going to happen when you're done, When you've played for a while, you get really sore, you have an achiness, you have a tightness, or it happens when you're playing. And those can kind of tell us two different things, because a lot of times pain when you're playing signifies a different kind of injury than pain after you're playing.
Right. And that's definitely something we're going to be getting into in the next one, for sure. And I think people are really going to be interested in that as well. We do want to do like a little bit more of like the 101 stuff before we move on to 102, which is the whys and hows and whats. This one, we're going to be talking a little bit more. We've talked about the structural components of the hand. We've talked about what the hand, wrist, and forearm do. Let's talk a little bit about the hand is supported, I guess, and how those movements are supported. So that people get a kind of good grasp, no pun intended, on how their hand holds up.
Yeah, I think zooming kind of back into what we talked about, like first, the very basic level of that structure is your hand. Is in your hand is the bones itself. But kind of holding that aside, because that is just such a basic level, we almost can kind of take it for granted and recognize that, like, okay, so your skeleton is designed a particular way. You have those arches in your hand. Your bones line up to create those moment arms that your muscles and tendons are taking advantage of. So it really breaks down into active and passive support. And active, you've heard us talk about it already, this video. Active is really those muscles. And muscles in your hand work to support your hand in two ways. The two types of muscles, really. So one is extrinsic muscles, and those are the ones that I mentioned before. We showed that cool graphic of all of those muscles entering through your wrist into your fingers to do flexion and extension. Those powerful muscles live in your forearm. And you, again, can feel that if you flex your wrist up and down. You can even see my muscle moving, my massive guns there. And those offer that extrinsic control. So the names of that by your elbows, the extensor and flexor wad, those help to create power grasp in your hand. That's really their main job. And then secondly, we have intrinsic control. And I mentioned before, your hand's not super big, so there's not a lot of big, powerful muscles in your hand, but there are some really important ones that help stabilize, especially your finger joints during power grasp and during actions with your fingers. So those all live in between. There's three sets of intrinsic muscles, the ones that live in between your fingers, and they do this. And then at your thumb and at your pinky, those are the other two big groups of muscles in your hand, and they basically let your thumb do this. They let you grasp. A lot of times if you're having pain, you'll have it in one of those three places in your hand, and that can clue you into maybe that's a muscular issue.
All right, so there's our active support. What about passive support?
Passive support, it goes down into those two types of connective tissues, your ligaments, which connect bone to bone, and tendons, which connects muscle to bone. And the passive support piece, you want your tendons to have a certain amount of tension to them, that they provide enough support, but they're not over tight or overstretched or overstrained. So striking that balance is what your body is made to do, but everybody's going to shake out differently on the spectrum of how tight are your ligaments in your hand naturally. And that, again, is defined by epigenetics, genetics, biology. It can be affected by age, by if you've had an injury, maybe you stretched or strained or tore one of those ligaments, it might heal in a way that's slightly tighter or slightly looser than it was previously.
All right, so let's kind of summarize what we've talked about, right? Talked about there's a whole bunch of different structures that make up your hand. You've got bones, you've got muscle, you've got ligaments, and you got tendons. Bones are the basic building blocks. Ligaments connect bones to bones. Tendons connect muscles to bones, so the muscles can do the work that they need to do, and that's how your joints move. Most of the muscles that control your hand live outside your hand, in your forearm, up in here. But a small number of them do also live in your hand, and they do slightly different functions. And all of them together create what we call composite motions, or complex motions that combine things together that let you do all the movements you want to do with your hand. When you're having different issues going on, it can be related to those muscles, weakness, tightness, or an alternating pattern of both, so just imbalance overall. It can be related to those ligaments and tendons, perhaps a strain or a sprain. And it can possibly be related to inflammation happening at the joint or the cartilage level. And the cartilage is just kind of nice cushioning between the joints. This episode was all about looking at what the hand does and how it functions. Next episode is going to be about how the hell do I make that work for me, and how do I tell when it's going wrong. So make sure you tune in for the next one, because this is going to be even more directly applicable. This was your base. Where you build from here is going to be all about what you do about your hand when it's not doing what it's supposed to do. If you want to learn more about hand stuff, you can follow Jess on Twitter. She is OT Jessie B on there. If you have PT related questions, feel free to hit me up on Twitter as well at Kate McGee PT. And tune in for our next episode on Hand Science 102, what to do when your hand fails. All right.
All righty.
Guys.